alaikum. Welcome to the event, guys. So I'm here to talk today with you about my experience in IC1. Now, I think I have to sit here. Now, they said IC1 is really hard, sort of the hardest. A lot of people fail, we're gonna fail, we don't know how to study, and all that bullshit. That's not true. It's basically if you know how to study and how to organize your time, you will ace it. Simple as that. So, in my year, I think in your year will be different for the IC. In IC1 we had FMIP, which stands for the Foundation of Microbiology, Immunology and Pathology, and Cardiorespiratory and Hemato-Oncology. So these are the three main content of IC1. Now they included, I think, they separated the FMIP into the microbiology and the pathology, from my understanding. And the hemato-oncology, they separated it into these two subjects. So we totally have three. But I think it's the same content. They won't be changing too much because you have to learn these things. So these are all marked as standard, which I think you're not interested in. And these are the new ones that you will face next semester. So for the foundation and pathology, you have an MCQ that worth 30%, 50% on written paper, and pathology and microbiology MCQ, and that's it. And goes the same for the FMIP in microbiology, and also for the cardiorespiratory. Now, the FMIP lectures are divided into three main topics. You have the pathology part, you have the microbiology, which is in the other section, which is really long, because I think it's the longest topic on the FMIP in our year. That's why they separated it and they put it on different subject. Now there is, for the FMIP or the foundation in the microbiology, I advise anyone who's studying that to focus on 5 topics. Memorize it by heart, like your name. And that's are the staph, Staphylococcus, the Streptococcus, the Haemophilus influenza, Neisseria, and the last one is Neisseria, Haemophilus influenza, Strep, and TB. So these 5, you have to memorize it by heart, because normally they have to bring a question in the written exam. And as you saw, it's worth 50%. So it's different from JC, where most of the marks come from the MCQs. So you have to focus really much on these 5 topics. Now, in IC, the teaching, you have to change your mentality in learning, okay? It's not about memorizing. Memorizing won't work that much. You have to understand IC, because it's all about pathology, it's all about diseases, and in IC, it's the build-up of you as a doctor. So if you really understand most of the pathology of the diseases, it will help you in senior cycle, in your residency, in your internship, and in your life. But you have to understand it. Why this, for example, pulmonary embolism? How does it happen? Why the symptoms with it happens? What is the science? Why the science comes? You have to understand, not just memorize it 1, 2, 3, 4, and that's it. That won't work. You have to understand, because in the exam, you have too many information, too many topics, and if you don't understand, you can't just make up something, and you have to make up something in the exam. Because too many topics you have, and you have a little short of time, and you have to write everything you know about the topic in an organized way, and also answering the question, and giving extras, and that's how you get really good marks in the written exam. So you have to change your mentality from memorizing to understanding. Like, one tip, if for example one day you sit down, you hold one topic, one disease, and you say, okay, cystic fibrosis. I want to understand everything about cystic fibrosis. As it's a journey, every day one disease, understand it, summarize it. And this will help you a lot in the examination. Now here the CR cardiorespiratory. From the name suggests, you have two main areas. You have the cardio and you have the respiratory. The cardio is all about maybe about 12 or 13 diseases, and the respiratory is the same. So you have 13 diseases here, 13 diseases there. And these are the main stuff that you'll be asked on. Now in JC, from my experience, it was all about the small little details in the lecture. They will always ask you about MCQ about it. So what is the smallest artery that may or may not, these kind of questions. In IC is different. The whole MCQ is about someone presented with blah 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 and his examination or blah 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 and what is the obvious treatment. So you have to conclude what is the correct diagnosis, and then based on that, so it's more of understanding. That's why I'm saying it's all about understanding more than memorizing. Simple as that. If you understand all the diseases, you'll be fine. And the best way to do that, because it's too many diseases, and before the exam, the information might go. That's why I say summarize it. So before the exam, you just write your summary. It makes it so easy for you. And for the HEMONC, I think, as I said, they scattered through the three subjects but we had lymphoma and leukemia, we have some microbiology, and we have medicine lectures. Now, for me, it was the most important thing. It was leukemia and lymphoma. These are the more it's so easy to have a short note about leukemia or lymphoma. So if you do understand it, try to read about it outside, not only the lectures. Try to read it outside so you understand it. It's all about understanding. That's what I'm hoping to emphasize on. Just understand, understand, understand. Now, one thing. Some of the lectures, for example, FOMIP or FOMIP, not the cardiovascular, they have some lectures called surgery and medicine and pathology. You have to know them. Like everything in Moodle, try to learn it learn it really well, and then the extras by something else I will show you. It's called CalPath. CalPath is very important, but I will go into detail in a bit. So you have to memorize the medical. So in medical, they talk about the surgical is for example, a person presented with a pulmonary embolism. What surgery would he undergo? So what is the complication? What is the indication for the surgeries? Pre-op, post-op, before the surgery, after the surgery, what do you do? Management. These are the surgical lectures. And then you have the medical aspect of it. It's like signs and symptoms of specific disease, drugs, and so and so. These are all in the medical. So first, you start with the pathology, understand the pathology, go into the medical lecture of the same topic, then go to the surgical with the same topic. So it all makes sense. At the end of the 3 lectures, you know what pulmonary embolism is. And now for the CalPath, I have to go outside. CalPath basically is an extra resource for the information. Now in the RCSI, once you start doing the IC, they expect more. They don't expect you just to rely on the lectures, which is fair because it's really important stage in your medical career. So you have to rely on extra resources, and that's what you're going to be doing for your whole life. And as a doctor, that's simply what you're going to be. So that's why they have so many extra curriculum that they expect you to know them. So now I'm going to explain to you the CalPath. Now if you study only the lectures, you will pass. But 50, 51, 52, 56, only lectures. Okay? But if you study the CalPath, you can get first honors. Okay? And these CalPath, it's simply helping you to understand. So coming back to the point of understanding, not only memorizing. Because you can memorize, you cannot memorize the CalPath. Never, you cannot memorize it. But you can memorize the lectures. And that's what they want you as a student, to change your perspectives from memorizing to understanding. I try to do a screenshot, but it's too much for the CalPath. So that's why I decided to show you live, which will be more helpful, hopefully. Yep. So, for the CalPath, you have the tutorials, the main tutorials for the pathology. Now, when you study the pathology, these are the main ones. These you have to go through them and read them. For example, we will have one lecture in the foundation of microbiology and pathology. You will have acute inflammation and chronic inflammation. So you go to that, and then you read. You have question, learning objective, and then go and read about this, understand it, go next. And they actually ask you questions in the exam and the MCQ about CalPath. They do. And you might have a short note, only the information is in here. That's the case. It happens to us twice. A whole question that whoever didn't study the CalPath won't answer it at all. Okay? So that's why it's really important. The tutorial are the most important thing. And then you have, after that, you have CPC. What is CPC? Now, CPC is case-based scenario. So they will have in the short note, either a normal question, for example, what is the investigation of TB, or a CPC. A CPC is case. It consists of 6 to 8 STEM questions. So they will tell you a patient came with weakness in his left arm, for example. Okay, what is the first step, second step? What do you do after that? Once he stabilized. So it's like question after question, question after question. And they can go to another topic that's related to this topic. Okay, so they might, in the CR, for example, they talk about, for example, shortness of breath, and then suddenly, which is rest, they suddenly go to the cardiac aspect of it. And they just bombard you with questions. So that's why these CPC are going to really help you in how to answer these questions, because it's really organized. And as I said, do the lectures, read the medical and the surgical, read the CalPath, and then go to the CPC. CPC to just, ensure that your information is stuck and you understand it. And then, of course, there's for each subject, so CR, FOMIP, HEMONC, and then image galleries. People say it's really important because in your exam, as I said, there's the MCQ, then you have the written examination, and then you have the micropathology. So it's all about pictures. You have a big booklet, and each question for one picture, and then you have to answer these questions about these lectures. Okay? So the image gallery will help you in identifying what is the organism, for example, a staph or strep. And as I said, FOIP in the microbiology, these 5 topics that I gave you, if you memorize it by heart, you will get at least 50% of the microbiology and pathology. That's simply, it's just so many questions about staph, strep, Neisseria, TB, hemophilus influenza, always asking about these things. So if you know them by heart, you will ace the exam, inshallah. And then there's some tests to see how, just to ensure you are understanding what it is. So it's all not really learning objective. Will point you where are you in your studying. So they say they will expect you 1, 2, 3, 4, 5. Okay, I've done that. Okay, that's I missed that. So you go and read a little bit about it, and that's it basically. So you don't study it. Quizzes, as I said, it's just like a revision to just ensure that information are stuck in your head. Slide list, well, if you have a lot of time, I never studied it, to be honest. People did, okay, and it helped, but I can't say that you will fail because of it or you won't get a first honor because of it. But if you're really interested in pathology and you love to learn more, you can do the slide list. It's really long, but if you will have time, So if you do organize yourself and you want to learn more, you can go to the slide list. But I can't say that it will guarantee you a first honor. A first honor guaranteed by the first thing, the tutorials at the beginning and the CPC. If you master that, you will get a first honor. And I think that's it, yes, and that's for the different... Yes, so that's it for finally I will give you a little bit of tips. Day by day, don't say I'll study at the end of the week, or a month before the exam, or 1.5 months before the exam, that how it worked in the JC, it will work now. It wouldn't work. It will not work. If you don't study day by day, that's happened to me. Like, I usually study 1 month before the exam, 1.5 months. Not something that I'm proud of, but I did, and I had really good punishment from that. And that I failed in some of the subjects, but I learned from it. And in IC2, I passed everything because I knew that I have to study day by day. And it's more about understanding, summarize. This is really important. Like, you know, when you study a subject, try to write down, for example, one disease, whatever, epilepsy, definition, write it. Signs, symptoms, investigation, management, complication, go through these things, write it in a paper. So before the exam, you know the information, but you just pinpoint these information so it's stuck. So when a written examination comes, you just ace it. There's a small book called Clinical Oxford Book. It's really small. You can carry it on with you. Whenever you're stuck in IC or any topic, just open it and read about it. Because the same summarization that you have, you might write, it's in there, but it's in more details. Pathoma book, a lot of people say it's great. I never used it, but people say it's really good. And it's helped you in the pathology part, as it's really organized and it makes the information really easy to absorb. I never used it, so I cannot really help you in that, but people said it's really useful. CalPath, as I said, and the most important thing, guys, you cannot just study all the time. Your body has a limit, and that's true. Study 24 hours a day for 7, that's never going to help you. You, as a human, you have your brain that needs rest. You have to have fun. You have to do stuff that sport, do stuff. Don't be stuck only with studying, because that will not help you. It will increase the stress if you don't do anything. You will be paranoid. I'm just really afraid. So have a life, balance. Okay, when in each day I have, for example, 5 hours of studying, 2 hours for having fun. Do whatever is more fun for you. Engage in societies, engage in club. Now in IC, I don't recommend you to have a role in something, so no responsibilities, because the main thing is about studying, but do involve yourself. Like there's an event coming up, there is a sport competition, have a life. And the last thing, the same thing that they told us when we were in your position, if you see us in the library, come to us and ask us. Because we are happy to help. It's been said to me for many times, and I did ask people and it did help. Whenever you have any questions, just come and ask. We're not going to bite you. We're not going to say, oh, get lost, we have studying to do. It's not going to take like 10, 15 minutes. And we'll be delighted because we're doing something for the others, which is basically what medicine is all about. So come and ask us, what is that, how we do this, how we do that. And if we know how to help you, we will. If you have something, we will send it to you. So be confident, go out of your comfort zone and ask. And thank you. So now we'll go to Nabila.
So good afternoon, guys. I'm very sorry we had a late start this afternoon just because I was running a bit late myself. So just by show of hands, any IC2 students here? Okay, just 2 students? Okay, fine. So I'm just gonna speak to you guys about this semester, and if you would like me to go on to IC3 later, I might do that as well. So as you guys already know, we're 1 month into this year, and you would have already had your first MCQs covering TROCMED and GI-HEP. And this is something new that you guys didn't have before. So we're going to go through what you can expect in IC2. So I'm just going to cover IC2 for now, okay? So you guys know about your 4 modules. So that's going to be your GI-HEP, REGUB, CNS, and TROCMED. You would have done TROCMED by now, so it's over. except for the finals, of course. And then you are around, what lectures are you on in Riga at the moment?
Renal pathology.
Just the start of renal pathology? Okay. So not started CNS, of course.
We started the forensic lectures.
Oh, okay. Okay, I see. Okay.
That's good. It started early.
We already done with the GI head and the trough.
Okay, okay. So you're running. Okay, that's great. So you guys have done IC1, and that's probably the real hit people really find jumping into IC1 from JC3. So IC2 is just the same as IC1. It's the pathology and microbiology of everything else other than cardio and resp and blood disorders. Luckily for you guys, you have much less microbiology to do this semester, so that should be a relief for you guys. And again, once you've passed IC1, you've seen how that is done. It's much less of a hit. IC2 should be much easier than IC1. So what you will need in IC1 is really your attendance for the pathology lectures. I assume by now you really know the importance of the therapeutics lectures as well. Dr. Alice Stanton, expects everyone to be there and to answer questions. And these topics in therapeutics should come up on your short note questions at the end of the year. And then you attend MDTs and CPCs. Your lecture notes are okay for the most part, not for Riga, but I'd say not for the renal pathology. So whatever you guys are doing at the moment might not make a lot of sense, but hopefully I'll let you know what you can do instead. So other than your lecture notes, CalPath, I guess also by now you know the importance of that. So CalPath is very important. It's just an online resource for you to go through pathology of whatever you're studying. And Pathoma. You guys have heard of Pathoma, yes? Okay. Do you guys have the book or the videos? The videos? Okay. And how do you find them any useful at all? Any use to you? Sometimes. How about yourself?
No, I don't use it.
Not yet. Okay. So Pathoma is a resource people find really helpful. It's the book is written by this American doctor in the States, and it's very, very popular amongst students who want to go to the States, who want to study for the USMLE Step 1. It's a very nice book because it's only a 200-page book, very thin, covers all of pathology very nicely. But we'll go to that later. So the books you might use might be Pathoma. And then other books, I really wouldn't say you use a lot of books, unless you're the type of person who really likes to read a lot of books. Probably no need for those. What you need to know, again, probably you guys know the Shemite one, and just like whatever Hassan was saying, for every disease, you want to know, the definition of it. Epidemiology is a big part that people usually would dismiss. I never studied epidemiology. But you'd find later on in your exam that you're going to get questions, and they all look the same. And the difference between one question and the next is going to be whether the patient presented was a male or a female, or whether they were young, middle-aged, or the old patients. So that is how you're going to determine what kind of diagnosis they might have. So do not dismiss epidemiology, particularly gender predisposition to certain diseases and age as well. And then you have to know risk factors really well. Risk factors are going to help you a lot later on. Other than that, the rest of the list is also very important. How the disease comes on, the pathogenesis of it, presentation, how it looks like how does the disease pathology look under the microscope. And then your differentials are again something that they would have stressed really, during all of the intermediate cycle. You need to, whenever you're presented with a case, you need to start to thinking from one symptom, just develop a list of things that the patient could possibly have. And then the rest of it is probably you're going to learn later on in senior cycle too. So CalPath again is important, like Al-Hasan just mentioned. I would say the things that helped me the most in CalPath was point number 5 there, so the learning objectives. You would be surprised. I don't know if people actually scroll down enough to find this on CalPath. Basically, what they go through is they have a list of questions, and then they answer each question. And you read the question, you read the answer, and you go next. And what I found is we had at least one question come up on the short notes from there. Same question, same answer. You had to know to also answer the question. So this is how it looks like. For IC2, the topics are not They're quite a lot, but this is what you will see there when you open CalPath. It's very useful, and then this is how it looks like later. So this is an answer to one of the questions, and then they have lots of questions for you to go through. This should be very useful. GIHEP is very underestimated. I know you guys have done the MCQs, and you find those a bit challenging from what I heard. Is that true? Yes, challenging a little bit. I know, like, you should guys expect that being an intermediate cycle, okay, you're almost expected now that very soon enough you're gonna be doctors. And, you know, doctors do not, you know, just memorize or know about just a few or a couple of diseases. You have to be ready for everything. And you have to know about everything. So they're gonna, you know, bring you questions in the exams, which are probably not covered in your lectures, things you haven't heard of or seen before. So this is okay. You can still ace the exams and get really high scores without, you know, having to know everything. But GIHEP teaching is very easy. The exams are a bit tough. So that lecture on the different adenomas and the polyps, very important. Very, very important. Okay. Renal, so REGAB, you guys are doing also. Generally, the lectures are great. Okay, they're not bad, except for the renal part. So everything with the kidneys is really, I found really terrible, to be honest. You guys, we would have had Word document notes, so like notes on Word. It's like a Word file. Those were okay. Yeah, they're not too bad, especially when you're trying to differentiate between nephrotic and nephritic syndromes. Have you done those? Yes? Yeah? Okay, nephritic, very important. Not well done in the lectures. Probably notes will help you, and then things like Patoma as well. Later on in the year, I might pass down this presentation we were given by our peers in the years ahead of us before, and they went through you know, renal pathology very nicely, and people really benefited, so hopefully you'll get to have these as well. CNS is not bad, actually. You might think there's a lot to cover, especially with the addition of forensics in addition to everything else. But generally, it's very, very straightforward. Forensics is, you know, just a lot of like information for you to know. I know people tend to skip the lectures of those, like not attend. Do you guys have to have attendance? Do they check attendance for you?
I think yes.
They do? Okay. So the thing about forensics is, okay, you can do without maybe attending. I wouldn't necessarily recommend that. But don't dismiss it, because there's always going to be one short note on forensics, like a complete short note on forensics. So that's the third of the paper almost. TropMed, you guys, you know, you're done with this, but it should be very easy to pass this module. If you know enough about HIV and malaria, really no need to stress the other topics other than that, especially for the short notes. MCQs, how are those? Kind of, yeah, half-half. See, TropMed, you know, there are lots of like weird and wonderful organisms and parasites which cause random things. You need to know those for your MCQs, but those are over now. So if you just focus on HIV and malaria for later, that should be fine for you. The interesting thing they've done this year is that they split the MCQ so that you have some in the middle of the semester and only half at the end. I don't know if you're finding this a bit useful or not. I would say no. Okay. Do you have another MCQ coming up later?
Yes.
For CNS and REGA? Okay. So I think the good thing about it though is that they force you to study day by day.
Actually, we write a lot in the comments for 2.5% because you never study for it, and then in the finals you'll be in struggle but if you study from beginning like it's way 30%, you will study from your heart. In the final it will help you a lot because you already studied pretty well, and that's one of the things that we really was frustrated because it was only 2.5. We never study. It's like to have a track of what studying is. Is it good? Is it bad? Oh, we'll see in the exam, you know? And it wasn't helpful.
I'm afraid it was our fault that you guys have to have mid-semester MCQs.
Finals in a month. Like we studied 2 whole modules in a month and did the MCQ final. So that was a bit challenging. We didn't have enough time to like, study well for these 2 MCQs.
I see.
So
So, you know, you know. Yeah, you can't do much about it, but the good thing is that it keeps you studying day by day. You know, if you don't have motivation, you're gonna get the motivation. And hopefully you guys should do fine at the end of the year as well. So just a few tips there. You know, when you're doing different modules for IC, try to group the lectures that are related. So you're doing some pathology lectures, and then you have some micro that's covering the same topic, like, I don't know, pyelonephritis, for instance. And then you add the clinical medicine lectures and surgical lectures as well, for instance, chronic renal failure or something. So try to group them together and study them together, like Modda taught me. And do not dismiss things like incidence and epidemiology. Again, gender predisposition of certain diseases, male or female, 4Fs for cholecystitis or things like that. Try to pick out the salient features of particular diseases. You have something like ascending cholangitis. There's a triad for that, fever, rigor, jaundice. If you study or if you learn off all the different symptoms and signs, you're going to get lost in the exam because patients are going to have the same symptoms and same signs. And they have different pathologies. Beaumont is not great to go to. I mean, probably commuting by bus and it's just tiring. They don't have proper lunch. Try to, be good to yourself. Make sure you guys have lunch and things like that. If you're having like really busy days, if you do 1 hour of studying, you should be okay a day. And begin now, right away. Okay, don't wait till later. Thank you so much.
Just one thing before we finish. Regarding IC, guys, therapeutics lectures are very important. Very, very important. In 2 exams, we had a whole question, only therapeutics. From only the therapeutics part. So study them, very important. And the leukomotor, the CNS, the forensic, they asked us a question that was so stupid that no one answered because it was only like 5 slides. And we said, there is main points we will study, and we skipped the small stuff, and it was horrible because no one answered that question except who so memorize it because it's only 6 lectures. There's definitely one question coming up. It's really boring lectures, like if someone died, how do you go to the police? And then I don't care about I'm a doctor. I'm not, But you have to read them, and when you think it's something can come in the exam, try to know it really well because it's a guaranteed question. Okay? Because in the RCA side, as you all know, in the IC, you might study 100 slides, and they will ask you about 2 slides in that lecture. That's how the questions are. But in forensic, you have 6 lectures and definitely 1 question. So don't underestimate it with the therapeutics. It's very important. Very, very important. For the recap, as she said, the notes, the word
on the word file.
Yeah, and in the finally in the tropical medicine, malaria and HIV. Malaria and HIV. They bring 1 year malaria, the next one is HIV. Malaria, HIV it's been there in the last 4 years, I think. 4 years.
Alternating.
So, and remember there's the CalPath part. In the exam, they brought us a whole question, this exact same thing as the CalPath question. Exact same thing. So, know these things, know the lectures, know the CalPath, and you'll be fine.
So it might be for you a bit early to know about IC3, but I think it's good to know just a general overview of what you are going to face the second semester. So IC3 is going to be very different to everything you've done in medical school. Okay, this is where you do not have to attend regular lectures anymore. So what you're basically put on is you are expected to be attached to hospitals. So you go on to different hospitals, different clinics. Sometimes they're in Dublin, sometimes, let's say for the most part, they're peripheral. And, you're assigned to different teams. You can be in a hospital in Drogheda, and in Drogheda you might be attached on the endocrinology team. So you're just a student and you're attached to different teams. What you're expected to do in that case is just, speak to the interns who are there. And really, the gist of everything is just to see patients as much as you can, just exposure to patients. Hello. Before I go into IC3, I just want to explain what you guys would do later as doctors. So when you qualify and you graduate from college, first thing you're going to do after you finish is do something called an internship year. Okay, it might not be there as an internship here in the States. I know they have different programs, but you're going to be let's say you're going to have the last position or the smallest position on a medical team in a hospital. So in a hospital, you have different teams. For example, let's say there's a cardiology team. So the head is going to be a cardiologist, the consultant, and then below them are going to be doctors who are still they're still training, let's say, in cardiology. So we're going to have a senior registrar in cardiology, a senior house officer in cardiology, and then the interns doing cardiology rotations, and then you have medical students. So the way hospitals work is that you have, let's say a patient is admitted to hospital and they have to stay in hospital. So they're going to be assigned different consultants and different teams, and what usually happens is it's the intern's job to go and take a full history from that patient and present the patient's case to the team. So you go, you speak to all of the patients under your consultant's list. You take a full history, do a focused examination, and then you go back and you report what you found to your senior health officer or your registrar, and then eventually consultants, drop by for like 10-20 minutes. They do their ward rounds very quickly and then they leave. So it's really the doctors in training who are doing the most of the work, and the consultants are there to kind of guide you, to tell you, watch out, don't forget that CT scan, or make sure you order this test really quickly, and this is how we're going to manage the patient for the most part. And then they tell you what to do, and then you do it. So really, all you need to be doing is knowing how to take a proper focused history from a patient, and then knowing, okay, what sort of examination you're going to do. You're not going to do, all the different examinations on a patient. And then after that, you need to be able to pick out the most important features there and then report those to your consultant. You're not going to bore the consultant with, all the details of the patient's life, like, he works this and his mom died of this, and he lives in a 2-story house, but he doesn't like doing this. But you need to pick out the really important points they're going to be looking for, and then you're going to be able to do your job that way.
Sorry, just a question about that. Are we suspected to diagnose? To know, to present to the consultant?
As an intern or as IC3 students?
Yeah, as you said.
As an intern, you're expected to come up with a differential diagnosis list. So you need to have at least like top 3, most probable diagnoses. Obviously, it's not that if you don't come up with a differential, the patient, something's bad's going to happen to the patient, because the seniors then, they go do and they repeat the same process, and then consultants would do the same again. So there are like multiple layers. They're less likely, it's less likely for like a medical mistake to happen somewhere along those lines, but they're going to expect you to know top differentials. You're going to have lots of exams afterwards, different licensing examinations where you're going to be expected to know the commonest, disease in a particular patient population. So no more lectures per se, like, attending college. You don't attend college anymore, you're always away. And it is like a screenshot or like a snapshot of what you're going to be doing in final meds later on. Right. So IC3 is split into, according to college, 2 programs. So there's the clinical program where you're just in hospitals on the wards, and then there is the SSC, which is you doing research in school or abroad. Hello. Do you guys have a brief idea what SSC is or what that thing is? No. Okay, so SSC stands for Student Selected Component. Almost sounds like an elective. It's just something that they give you the option to do whatever you'd like, as long as you meet the criteria. So what you need to do in the SSC, you're going to have 6 weeks to spend doing research. So what usually tends to happen, if, let's say you've never done research before, you have no clue what's happening, once you reach your SSC block, college is going to give you a list of different research projects that are available through RCSI principal investigators. So different people work in college other than the people we see. Those would mainly be doing research. The research can be lab-based or can be clinical-based. It can also be qualitative research, like different psychologists and what is it? Things to do with like public health, international health. They'll be doing different research projects. They're very different. All have different flavors. They're going to give you a list. You pick from those lists the projects that most appeal to you. It might end up being not as what you expected. It might end up being much nicer than you expected. But the secret here is not really it's not the project that's gonna make you get a good score. Like if the project's interesting, then you get a good score. You can have the most interesting project, the most exciting, the one with most potential to like get findings and like probably be published. But then you can actually get a really bad mark for your SSE. So it's 6 weeks. You're assigned to a supervisor. They can be based in RCSI. They can be based in Beaumont. You can go do your SSC elsewhere. You can do it in the States. You can do it back home. And then 6 weeks of research. Or supervisors, they're going to explain everything to you. Basically, what they give you is like a small part of their big project. You're going to be working on that. You might do some lab experiments if it's lab-based. If it's clinical-based, it's probably going to be an audit. You might be looking through files and trying to gather information, doing some stats and stuff. But generally, it's a nice experience. Research is a big part of medicine. So some people go into medicine just wanting to do research eventually. They don't want to do, hospital work or any of that. So it's interesting. So did you guys do research before? No? No? Not? Shadowing. Shadowing, but then not doing research.
Not actual, but writing.
Okay. I know some people would have done the summer, what's it called? Summer research school? So you guys haven't done that? Okay. So yeah, it's totally fine. Like what I went to IC3 doing was, I said to myself, okay, I have a summer, I'll do summer research, and then when I go into IC3, I'll have the best, research project, and I'm gonna ace it, I'm gonna get the best grades, but it's not really realistic that way, because you can't really, you get the gist of it, but then depending on the work you put in the actual project, then you're going to get the results. In all cases, it should be really enjoyable. It's a new thing. It's not going to count for a lot of marks in general, because if you think about it, your GPA in med school depends on 4th year and 5th year. 3rd year, 2nd year, 1st year does not count for nothing. IC3, to be honest, is probably 0.5%, but that's really nothing. Okay, so you choose, and then if you choose before someone else chooses the project, then you get it. If not, you don't get it.
Yeah, about that. Do you know when they release?
When they release them?
Do they notify us, or do they?
Good question. I think they would notify you before the semester ends. So in IC2, they're gonna tell you. Good question. I wonder if that's gonna be in November. Exactly, but you're not going to be, you're going to still be in IC2, and they're going to release it one day for maybe a week, and the earlier you go and you pick, the more likely you're going to get the option you picked,
Is it better to do it American or
See, that's the thing, like some people, come into 3rd year and they know they want to do research about this particular topic. Like, I want to be a cardiologist when I, qualify. So I want to do cardiology research, all the time. And I want to do 5 projects, and I want to get 2 published. So these people, if you have a tendency towards research and you want to really like it and you want to do it, then you might want to pick the best cardiology centers in the world.
Tech University of Washington, but they are asking me what are you supposed to learn after 6 weeks? What does the college want?
Okay.
There's something really enough like for 6
I see.
weeks.
Okay, I understand.
What are the outcomes? What do you have to do after you come here?
Okay, usually they go through this or with you, but really what you want to know is very generally, very briefly, what is the research process? How does it start? You have to have like a research question, and you have potential. You have to form hypotheses, and then you want to prove them or disprove them. For instance, in like a lab-based thing. So I wouldn't say you should be too worried about not meeting the learning objectives, because any research project is very likely to just meet the criteria, and you don't really need to stress too much about it. If they're asking for something, you can go ask Sarah's office, be like, I want to apply to this, and they're asking me for objectives. Can you guys supply me with any paper? They might have one ready-made, or they might just make up one for you. If you want to, certainly. Like if you're worried you might get like a really bad supervisor or like a really stupid project, from now you can start contacting different people who probably work in college or people who work abroad, if you want to go abroad, and see if they're willing to take you on, 6 weeks, one project. That would be great. If you have this confirmed before next semester, you can go and do that. The college is not going to mind at all. Okay, so this is 6 weeks. At the end of it, you're going to write a report. Okay, introduction, methods. How do you come up with? How do you do the actual research? Did you give out questionnaires? Did you do lab experiments? And then your findings and the discussion about what you've done. Shouldn't be too long actually. It's very manageable to do. But what happens afterwards is you need to. They give you 2 weeks to write up the report, so that's enough time for you. And also you need to present it already. The good thing for you guys this year is before they used to have more marks on the report and the presentation. Now they have a third of the marks on your performance. So it's just going to be, if your supervisor thinks you weren't absent like none of the days and you were always there and you were professional, you're going to get a third of the marks. So that's sorry? No, that's only SSC, sorry. Yeah, so it's easier for you to get. Like for instance, I would have done research before. I went to my project. I thought, I'd do great. I didn't do great, but it was okay. But you guys, you should be able to see like a higher scores than we did. Okay. Second thing is you're gonna have a week of lectures. This is only because of orthopedics. So just like prop med, you had 1 week prop med, every day 7 to 5, and I was just regurgitating like stuff. It's gonna be the same. So it's not great. So if I'm not mistaken, you probably have it at the beginning of the semester. So that's the first week you're gonna get. So people ask me, shall I attend or shall I prolong my vacation for 1 more week? It's much better for me to spend time with my family. Really, it's up to you. But I'd say if you attend, you're gonna learn the lectures one time. If you're gonna go through, there are at least 70-something lectures in orthopedics. I really doubted that anyone is gonna, find some time and go through 75 lectures of orthopedics on their own. So I'd really say attend those. They have a great lineup of orthopedic surgeons who would show up to give you special lectures and on special topics, and it should be nice. And to be honest, after orthopedics, after that 1 week, I thought, I might do orthopedic surgery later on. So I really liked it. So that's the 1 week of lectures you get. And afterwards, you're gonna have your clinical placements. So in general, it's either medicine or surgery. Final year is either medicine or surgery. So we're gonna be placed for 4 weeks doing medicine, 4 weeks doing surgery, and then 2 weeks doing an additional rotation, probably medical, and another 2 doing surgical. So it's really the same thing. And then you're gonna have 2 weeks of placement for orthopedics. Yeah, so just because you guys are third med students, they're not really gonna give you a lot of attention because they know that, there's no need for you kind of be in hospital and there's no need for them to waste time teaching you things. But you can be lucky and find people who actually would be willing to teach you. For the most part, what happens in medicine and surgery, looking at the exams, you have 2 exams. One is called the short case, and one is called the long case. Short cases from now on, it's just they're assessing you doing physical examinations, so it's almost just like the OSCEs you've had before. You go in, do a physical exam for 5 minutes, and the small difference here, they might ask you 3 or 4 questions. What might cause this, what might cause that? Very simple. You're gonna have 3 stations, 3 physical examinations, not too bad. The difference now is you're gonna be expected to know a few more examinations than you used to know before. So in addition to your GI, cardiovascular, neuro, up and low limb, and cranial nerves, you need to also know thyroid examination, breast pump examination, rheumatoid hands examination, a stoma examination, and a hernia examination. So you have things to learn, and throughout your placements, in different hospitals, the interns, and you have tutors. We're going to come and teach you how to do this. So it shouldn't be very difficult, it's just you're learning a new physical examination. And then finally, the long case. The long case is where most of the marks are going. The long case is an exam where you are brought to a patient and you need to speak to them for 25 minutes. You're going to take a history, summarize the history, do a small physical examination, and then very briefly in 5 minutes, you and the examiners, you're going to discuss how you would investigate the patient. Like, oh, he came in with a RESP symptom, for instance. I'm suspecting pneumonia. I do a chest X-ray. He has low oxygen saturations. I might do an ABG and check if he has acidosis. How would you treat them? Oh, I'd start IV antibiotics, or I'd give them oxygen therapy, etc. So this, again, the long case and the short case, you're gonna see those again in final year. This is what we need to do this year. So it's really very brief. So 2 books you need. Sorry.
In cases, what do you suggest? I mean, how do you practice for them? I mean, what do you suggest to do to practice?
You mean just the physical examination?
Yeah, the whole thing, the whole procedure. I mean, should we apply our theory, what we learn, or should we? Is it?
So just to remind you, so the short case is just the physical examination, so just like the OSCE.
The long case, though.
Oh, okay. Long cases, yeah. So long cases, you're gonna get in hospitals. So interns on your teams, they tend to give you tutorials. So they're gonna get, so we call these, bedside tutorials. So they take you to patients on the wards, and they take you to the commoner cases, like let's say heart failure or pulmonary embolism, and they pick on you, like, would you like to speak to this gentleman, find out why he's in hospital, and you ask him questions, and then he's gonna, be like, oh, what else would you like to ask the patient? So it's just tutorials that way. Now you can also use this book, so the red one there. It is amazing. 25 chapters, symptom by symptom. What questions are relevant for you to ask? It's gonna go through everything, like chest pain, shortness of breath, cough, a lump, and it goes through them very systematically, and it's probably going to have questions you might be asked in the long case. We would probably use this also in final med as well, so it's really good, but it's very basic for you guys, and I think you have enough time to cover this book at least once, or probably even twice or thrice. It's very nice. You're going to love it because it is very entertaining to read. Even it's not boring at all. And then the second book then is just a book for physical examinations. It's going to have everything you need to know about, your thyroid examination, the ones that I mentioned, rheumatoid hands, everything. And this is also useful again for final med. But these 2 books, all you need for the rest of IC3. Okay. MSK, we mentioned, it's just orthopedic lectures, and SSC is just research. And then the rest of the year, you're using these 2 books only. And they're really manageable. Other people might suggest 2 other books. This is the Oxford Handbook, the yellow one. Really thick, but it's nice to have with you, in your pockets, in your lab coats, so whenever you're on the wards, the consultant says, oh, this is the diagnosis, and then you open to read if you don't know what you've just heard. The second one is a really thick book and big book for clinical examinations, probably useful only for final year students. But since you have a lot of time, you might want to read through that as well, because you don't have a lot of time in the final year. But you really don't need to. So again, this is the breakdown. So the OSCE is the short case. The MSK, so orthopedics, you're going to have a small MCQ. And then you have the long case examination, and that's where the bulk of the marks are going. And then your SSC, see how you have a supervisory assessment there for 30 marks, so that's going to be really good for you guys. And then your report and your presentation. Really basic stuff. So I went through this is a long case. Okay, so just a few questions for you. Are you guys planning on sitting any of the USMLE exams later? Yes? Yeah, both of you. That's very nice. Can I ask, did you guys ever attend these, they used to have the step 1 tutorials every Friday or Saturday. They kind of teach you in RCSI, I think they run this year. They run, okay. They didn't do it. Okay, if I'm not mistaken, right, so they usually start in 3rd year, so now, probably towards January, they're going to start giving you, so they're just going to say, every Friday, Saturday, we're going to have USMLE teaching, okay? Usually 2 hours here in one of the lecture theaters. Might be useful for you to attend if you guys are really into doing that. Hello. Whether you attend or you not attend, okay, I know that your American, Canadian colleagues would be, would have really gone past by a lot, probably more than you would have done. But in all cases, all you need to do really, if you don't have time, is pass this examination. So RCSI has this rule where they go, you cannot sit the exam before you sit our diagnostic mock exam and you pass it. Obviously, this is not a US requirement, it's just a college requirement. So this is just the exam for 2 hours at the end of March or May. And, it's just an MCQ exam on the computer. So what happened was I wanted to go to that, right? And I was saying, okay, I'm just going to attend all the USMLE teaching, and then I'll be prepared to, do really well on the exam. But I didn't, because I started attending teaching, and it was just too much. And then I said, خلاص, I'm not going to go to the diagnostic test. But the night before the exam, my Canadian friends say to me, actually go tomorrow, even if you haven't prepared, just do the exam one time and see how it goes. And I did, and I passed. So that's one thing off your list, right? So in the summer, when you come to the summer, then you can say, okay, I might start studying and do the step 1 at the end of the summer. So it's great. Just go, even if you're not prepared. You'd be amazed. I'd say you'd pass it easily as well. You can do it once, and if you don't pass it, you can do it again. So see how many exam dates they're gonna publish. They're probably gonna run it twice. Yeah, they even say, even if, let's say, you fail the second one and last one, they tell you that even, let's say, over the summer, even if you're abroad, they can book you a mock test to do online, and you can finish the requirement that way. But how serious are you guys in doing the steps? Do you really plan on going training in the States, or it's just an option?
I have a family there.
You have family there. Okay. And yourself?
Just enough to
Just an
see
option?
how we do it. I mean, I'm not going to the States.
Yeah,
You're sure you're not going?
And yeah,
You don't know, Yani.
I don't know.
See,
I
it's,
don't know either, but I just want to do it to prepare for the future.
that's
Because
good.
of
That's
our
good.
Country, having scholarship students.
I see. I'll tell you what I really believe. So many people dismiss the USMLE examinations, especially if they know they're not going to the States, and I agree with that in general. But the thing about the USMLE is, if I want to compare graduates for ICSI who would have done the USMLE and those who haven't done, I feel that there's a huge gap between those two. And it's only because they put a little bit more effort and time in doing this, studying more on their own. So I'd say what I wanted to do before was do the step 1 just for my sake. So just because I want to be knowledgeable about everything that they do that we wouldn't have done in RCSI. One last point. Where are you from? Can I ask? Iraq. Okay. And you're still from Yemen. I don't know if you guys know how things work, in your own countries, but I went back to Saudi, and in Saudi, so most Saudi medical colleges now would kind of incorporate the USMLE into their curriculums. So even their students are almost ready to sit the steps. So this shows you how many different countries, their med schools and their hospitals, they rely on the step 1 and the step 2. So I'd say it's a very big plus if you do them. Certainly if you study, even if you haven't done the exam, because you can do it anytime later. That's summer. Do you guys have any plans for the summer?
Research, hopefully.
Yeah. See.
Electives, can we do them after 3rd year? I mean, can you apply for electives at 3rd year?
You can. There are very, let's say, few places who would accept 3rd year students. It's usually for 4th year students, but it's still an option. And then what happened with me was I was asking people, what should I do for SC1? Sorry, this was supposed to be SC1, not SC2, because you guys are going to 4th year the next year. A friend of mine said, don't do anything about SC1. It should be fine. But really, thinking about this really seriously, we had people in my class, colleagues, who would have taken a year out after IC3 to prepare for SC1. So we're in 5th med now, and they're doing 4th med. Do you see? So it's just because if you want to get an intern spot in Ireland, or even to boost your chances anywhere else, you need to have really good scores in your 4th and your 5th year. So I think it's well worth it, taking some time, or probably just not really like studying, but just running through what you're going to cover later on in SC2. People study differently. Some people can do like a whole module in 6 weeks. But I'm the sort of person who likes to read a lot around the topic, and that wouldn't work for me then, So it depends on you. But I'd say have a look and look at the load of the modules. If you feel like it's a lot, you might want to just run through it over the summer if you have a lot of time. And research if you're into research. Otherwise, you have a lot of time, so you can relax. Okay, that's all. If you have any questions also, just let us know. You can come ask us at any time.
Thank you so much.
No, thank you.
And be contribute in class, ask questions, come early, revise with your friends, summarize, explain to each other. It makes the points stick in your head, literally, trust me. And there's a very, very, very good book.